Across the Philippines, non-communicable diseases like diabetes and hypertension are among the leading causes of illness and death. In rural communities such as Jagna, Bohol, patients often rely on irregular outreach programs and paper-based records. Philos Health, a local nonprofit, has been providing free medical care for over a decade. Their doctors and volunteers travel across barangays carrying stethoscopes, blood pressure monitors, and stacks of paper forms. Without a digital system, follow-up data is difficult to track. Medication histories are incomplete, and patient information can easily be lost between visits. The result? Fragmented care and missed opportunities for prevention. Our goal is to help Philos Health move from paper to progress by creating a reliable offline-first digital system that strengthens both data and community capacity.
Jagna is home to about 35,000 residents spread across steep hills and coastal roads. Health workers travel long distances, sometimes by motorcycle, sometimes on foot, to reach their patients. Most families depend on agriculture or fishing, and digital literacy remains low. Yet chronic diseases are growing steadily within these communities. Philos Health's vision is to make care continuous, not occasional. But for that to happen, data must move as reliably as their healthcare teams do, even without internet, even without power. Around the world, NGOs have introduced digital tools like OpenMRS and CommCare to manage patient data. But many of these platforms depend on stable connectivity or complex infrastructure, things that rural areas like Jagna cannot always support. So our team asked, what if we designed a solution that works with the local conditions and not against them?
To create lasting impact, we developed a two-pronged approach. First is a data management platform that functions fully offline and connects field data with central analytics. And a second one is a community education program that ensures every user from volunteer to patient can confidently use and sustain it.
At the field level, we built the HealthHive app, a simple mobile tool that allows health workers to collect patient information anytime, anywhere, and most importantly, under offline conditions. After logging in, each worker can register new patients, record vitals such as blood pressure and glucose, and note lifestyle risk factors. An auto-generated ID links each patient to their barangay and visit history. The app includes a flagging system that categorizes patients into low, medium, or high risk, helping workers prioritize follow-ups. All data is stored locally and is automatically synced to the central database once an internet connection becomes available. This ensures that even in remote mountain barangays, information is never lost and can always be integrated into the wider system.
Back at the clinic, the data collected through the app flows into the HealthHive dashboard, a DHIS2 supported platform that turns field records into a clear picture of community health, a population-level overview. It begins with the overview page, which captures the pulse of Jagna, the total number of patients screened, where they live, and the overall health status across barangays. This acts as the entry point, a quick way for staff to see how care is unfolding across the municipality. From there, the dashboard moves naturally into the analytics section, focusing on chronic disease management. Now here, trends in hypertension and diabetes are visualized, showing how many patients are controlled, at risk, or in need of follow-up. Linked to this is a cohort analysis, which traces patients' journey over time, revealing who stays in care, who drops off, and what factors might shape these patterns. Even occupation data appears here, too, helping Philos understand how livelihoods like agriculture or fishing influence health outcomes. These insights then connect directly to the field operations page, where data turns into action. It highlights which barangay needs more visits, which patients need reminders, and how outreach teams can plan their next rounds efficiently. Behind each statistics are also real people, and the patient registry makes that visible. Every digital card shows a patient's key vitals, medication records, last visit, and risk status, ensuring no one is missed between clinics. Finally, the data quality page keeps the system trustworthy, automatically flagging errors, duplicates, or unsynced devices so staff can correct them quickly. Together, these connected pages make the HealthHive dashboard more than just a data tool. It's a continuous loop of insights guiding Philos Health from individual care to community-wide decisions.
Technology only creates impact when people feel confident using it. That's why our first focus is digital capacity building, ensuring that everyone from volunteers to clinic staff can use HealthHive with ease. We designed hands-on workshops for volunteers and field workers, guiding them through the app navigation, data entry, and troubleshooting in real-life scenarios. For the Philos staff, training sessions focus on the HealthHive dashboard, how to interpret graphs, generate reports, and use data for planning and decision-making. Each session is interactive, visual, and grounded in the local context, helping participants see how their data connects to the broader story of the community health.
So beyond digital literacy, our second health focus is on health empowerment. Using the information gathered through HealthHive, we identified various risk groups, including at-risk and high-risk patients for chronic disease self-management workshops. These sessions are simple, practical, and community-driven, covering healthy eating, exercise, medication adherence, and blood pressure monitoring, all adapted to the local habits and resources. Patients learn not just about their conditions, but how to manage them day to day, with the support of students, volunteers, and Barangay Health Workers. So after each round, we also want to collect feedback from both participants and trainers, refining the tools and materials to fit the community's needs. And in this way, the program becomes a continuous cycle of learning where technology supports the people and the people strengthen the system that sustains their health.
As confidence grows in the community, the next step is clear. Put the tools to work at scale and measure what matters. We'll start with a short no paperwork transition where we'll capture all legacy patient records in CommCare while teams keep using the familiar visit summary cards. So continuity is preserved and clean data starts flowing. From January to March, we'll personalize the tools, finish MVPs of the app and dashboard, digitalize the backlog, and lock KPIs for coverage, continuity, data quality, and early outcomes. April to June is about people and product fit. We'll train stakeholders to pipe CommCare data into the dashboard, run quick pulse surveys and small A/B tests to refine measures and do final data cleaning so handover feels confident. The next year, we'll move into real-world proof. Monthly tech reviews for crashes and syncs, cost and governance tracking, and 2 evaluations. First, an impact and sustainability check. Then, a scale-out confirm using cohort outcomes and user feedback. From August 2027 onwards, we stay in a steady improvement loop with end-of-training questionnaires, monthly bug and data quality sweeps, and small regular tweaks. Risk like patchy connectivity or duplicate records are managed with offline first sync windows, strict merge rules, targeted refreshers, and quick run chart huddles. In short, practical, phased, and built to last.
With implementation sequenced and evaluation embedded, the final piece is feasibility, the numbers behind it and the constraints we must manage. We'll start with a simple lean budget, 100,000 HKD one time to build the HealthHive app, 10,000 a year for maintenance, about 11,200 for the database management, 8,000 for training materials, and 1,000 for basic operations and evaluation. We'll also set aside a small buffer for training delivery, support time, phones, or data stipends, system monitoring, backups, and a modest contingency plan as well. Potential future fundings may come from a mix of donors and government health budgets, and where possible, national insurance. Strong early results on the dashboard should help us unlock co-funding as well. Furthermore, our main limits are tech capacity, security, and cost swings, and we'll manage these with the DHIS2 community health and, if needed, a short professional engagement, clear user roles with routine backups, and twice yearly cost to impact analysis. Connectivity and digital literacy gaps are covered by an offline-first app and tiered hands-on training. As funding and device availability are finalized, these numbers may change.
As Philos Health grows its outreach, the HealthHive system will continue to evolve, adding new tools for medication, referrals, and other chronic diseases. But what makes the project lasting isn't just the technology, it's the people who use it every day. By turning paper records into real-time insight, HealthHive connects patients, volunteers, and decision-makers in one loop of care. From paper to progress, building a healthier Jagna, one data point and one person at a time.
Thank you so much for watching our video. We really hope you found our idea insightful and relevant to Philos' objectives and missions.
Yeah, we're very passionate about our work and we hope for the opportunity to go see Jagna with our own eyes and participate as much as possible.
So to learn more in detail about our plan and solution, please access our deliverables using the link in the description below or scan the QR code shown in the screen. Maraming salamat! Ingat!